Here we have a 41-year-old nurse. Her name was Sylvie, which is not true. She has pain related to the left rotator cuff. We never used the real names in those case studies, so that's why I'm laughing. A 40-year-old woman nurse has pain related to left rotator cuff injury, tendinopathy for the last 4 months. She was improving with her physio exercises and conventional treatment, but she still notices pain at the end of the day. She noticed that it affects her relationship with her patients. At the end of the day, she has less memory and less concentration, and she comes home very tired and has no patience for her second shift, which is being a mother of her 12 and 15-year-old children, and being also a spouse for her partner. So she used to take her dog for a walk when she arrived at home. It used to help her calm down at the end of the day, but since she has shoulder pain, she can't do it without increasing pain, so she had to stop. So she did notice that she used to have, she had enough interoception to notice that she had that before with walking her dog, and she doesn't have that anymore, and that was kind of her stress relief at the end of the day. So you can pause here and maybe see what you would offer her as a meditative practice. So, of course, again, with her, as with the first case study, we won't be doing only meditation practices. Of course, there was still some strengthening to be done, some motor control to be done. There was still some physical work to be done. But for her, we were noticing that she was very affected by stress at work, and at the end of the day, the fatigue, the concentration, the memory was going down. And she did have a very stressful environment at work. So again, with her, we started using the stop exercise. And what we did with her is that when she was going to wash her hands between her patients, she would wash away what she had heard or what she had felt with her last patient, and kind of bringing in the new when she was going with her next patient. And the other thing that we tried with her was we tried some mantra meditation and some rhythmic meditation to increase concentration and memory. And what we did here is that she was open to trying formal meditation, so we tried it in her car before she went into her house at the end of the day, to give her that pause that she used to get when she was walking her dogs, until she was able to walk her dog again. We did try for her to walk her dog using a leash around her low back, which helped her, but she couldn't walk for as long as she used to be able to do it at first. So we did gradually increase her capacity of walking. She would switch hands, wrap it around her waist, and so we did try that, but we were cutting that down a lot until she was getting her strength back in her left rotator cuff, because that was the way that she felt more comfortable with her dog. But apart from that, one of the things that really helped her were mantra meditations, and she was someone who liked to look at positive affirmations, so she would recite her positive affirmations when she were coming home in her car, before going into her second shift, as she called it. So that really helped her boost her memory and concentration, decrease her stress, and help her along in the moments that she needed to gain more strength in her shoulder, and without being so affected by her pain. So that was one of the ways that we helped her. So you may have other ideas for her as well, but those are kind of ideas that you can bring on to your practice. As you see, it doesn't change that I'm still a physio. We still do a lot of our conservative or conventional physiotherapy work, but we just bring in a bit of mindfulness, a bit of meditation. So what I would suggest to you to bring into your clinical application is talk with your patient, ask questions. Are they open to a mind training or meditation technique? You'd be surprised. Most people are. I think we're lucky enough that now in social media and in our community and culture now, we're starting to see that a lot of people find benefits from meditation. So a lot of people are curious about it and are open-minded about it. So you might want to change your language, as I said, to accommodate the belief of the person. So mind training might be a good thing. Sometimes people are a bit put off by yoga, so I say just contemplative practice. So depending on your patient in front of you. And just see how they are affected by their pain, how it changes their life. As you saw with Sylvie in the previous case study, it wasn't this big change, but it was affecting her, and those little changes that we implemented in her daily life really did a big change for her. Know that you do, clinically you could assess body awareness through a body awareness scale. To be honest, I don't use that in the clinic. I find it helps more from a research point of view, but I just wanted to mention that there are some scales that you can look at to assess interoceptive awareness and body awareness. And then one of the other clinical applications that I would suggest is start small. Start with body scans, small stop exercises, imagery of the affected area, yes, but also of other areas, because as you know, with persistent pain, people may have a harder time connecting with the affected area. So doing an imagery of a different area, oftentimes I'll use the nose or the tip of the fingers or things like that to bring in that sense of embodiment with the patient. And sometimes also just focusing on the breath for a few minutes really helps to just start small and kind of pique a bit of curiosity. As I say here, plant the idea, see what grows. So just start to see if that person is open to it, and maybe just plant some seeds in a little bit. Always do the practice with your patients first. See how they are feeling and validate their sense of security. So make sure that they feel secure when they do these kind of techniques.